Understanding Kolb's experiential learning theory can be quite overwhelming. In fact, more than 50% of our nurse educator colleagues on the journey to get their CNE don't fully comprehend Kolb's experiential learning theory and the five categories of learning theory that you have to focus on in order to reach that 70% threshold for application and analysis that is described on the NLN CNE blueprint. So, how are you going to do that? Great question. Let's talk about it. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educator colleagues on the journey to achieve CNE success. The only way you won't achieve CNE success is if you quit. And we're here to support you, to come alongside you, to guide you as you move forward on your journey towards achieving CNE. The transformational process really is what the CNE exam journey is all about. We talk about every week, just like we're going to talk about in this snapshot, what are some key concepts, some key elements related to the actual blueprint that's going to help you pass the CNE exam. Time is our most valuable asset because once it's gone, we can't get any more back, right? So let's take a look at it together. First and foremost, I want you to pull out Billings and Halstead Teaching and Nursing. We are still in the sixth edition. All right, sixth edition. And I know you all already know why, but just to recap for our new colleagues that may be in the room, that is the edition that the NLN exam writers used when they wrote the exam, the revised exam in 2024. Actually, I think it was 2023, but they revised the blueprint in 2023. And slowly we saw some new exam questions come out. All right. So this is what we want you to do. Go ahead and print out the study worksheet. That's listed right here in the description. That's going to help you, first of all, have some increased accountability for the time that you're spending in our snapshots. If you're joining us for our workshops, right, we want you to use the same study worksheet. You're going to write down, number one, the date. Number two, what is that burning question you have as it relates to learning theory? Now, we're going to talk about Kolb's experiential learning theory today, but we want you to think about what are those burning questions? What are those unresolved concept gaps that you have related to learning theory and specifically Kolb? All right, and now what we're going to do is we're going to take a look at that thought-provoking question and see what you think about it. If you haven't seen it yet, it's okay. We're going to look at it together. And we're also going to look at some content in Billings and Halstead textbook. Okay, again, sixth edition. So we're going to do a couple of different things during our time together for this snapshot. So first and foremost, here's the thought-provoking question. The nurse educator is helping students move through the Kolb Experiential Learning Cycle. To facilitate the reflective observation stage effectively, the educator should engage in which teaching strategy? A is conduct a lecture with additional reading summarizing key points from the simulation. B, organize a group discussion where students can share their thoughts about the simulation. Or C, assign a group project that includes developing a case study about the simulation topic. All right, so I want you to think about two thoughts. Number one, what is this question really asking me? And number two, what is it that I know for sure about concepts related to this question? All right, so I'll give you all a second to think about that. And then for colleagues that do have Billings and Halstead textbook, go ahead and pull that out. All right, because I want you to look at specific page numbers in Billings and Halstead that we're going to look at together in a second. All right, so you're going to put a hold on your thoughts related to this thought-provoking question. And now you're going to take a look at Billings and Halstead on page 181. All right, so we're talking about learner-centered courses. What does that mean to you when we say learner-centered? All right, so go ahead and write that down. What does it mean to you when we say learner-centered? What does that mean to you when we say learner-centered? All right, so hopefully you all are on page 181. In your textbook, you all can see that I have the digital version. So learner-centered courses, you've written down what your thoughts are about learner-centered courses. And this is what I want you to remember. First and foremost, we are aligning it with two learning theories during our time together today. First is going to be David Kolb's experiential learning theory. Second concept or theory we're aligning it with is Patricia Benner's novice to expert model. Okay. So, first and foremost, we know there's an increased emphasis on our ability to truly engage the learner on the learning journey. If we're moving forward and developing content in our course, and we are not engaging our students in discussions using Socratic questioning, then we may be leaving them behind. We want to engage with our students in discussions, meaningful discussions that are going to allow them to build on their prior knowledge. So, how do they do that? Well, first and foremost, we want them to be prepared when they come into the classroom. Okay, so number one is preparation. I'm trying to get my iPad open so we can look at this content together. We'll see if this works. All right, so that's first and foremost is we want to engage with students using Socratic questioning. And what that means is we want to ask open-ended questions. We want to engage in a dialogue that allows students to be active participants in our discussions. Okay, so first we want them to be prepared for learning. We do that through assignments. Second of all, we want to engage in Socratic questioning when they arrive in the classroom. So how do we do that? Well, first and foremost, we want to allow students to have hands-on experiences in the classroom, right? That's helping to bridge that theory practice gap that Patricia Benner talks about. A great way to do that is by engaging in the learning process and journey before students enter into the classroom. This is why tickets to class are so effective. This requires that students do the work even before they come into the classroom. It can be something as simple as a 10-question scavenger hunt. So we could ask students to complete 10 questions related to content in the textbook readings. We could simply ask them to write down the first concept that is listed or the first intervention that's listed in chapter 10 related to care of the heart failure patient. Was the first intervention that's mentioned in order for us to properly care for heart failure patients that results in positive patient outcomes. All right, so that's just one example. All right, so let me see if I can share my screen. So what else? So we talked about number one is we want to learning to happen. So before students enter the classroom, so that's flipped classroom. Okay, number two, we said we want to increase engagement with Socratic questioning. Okay. And then number three, and this is all around learning theory. We want to engage in think, pair, share, right? We want students to be able to get in a group with each other and to exchange ideas, right? Exchange ideas with each other in a way that promotes and advances the development of Kolb's experiential learning and Patricia Benner's novice to expert model, right? And we know with David Kolb, there's 4 phases of the learning process, right, that we've just identified here. And we know that there are 4 learning styles, right? 4 learning styles and 4 different phases of the learning journey. So what do they have to do with each other? Well, when it comes to learning, we want to help students get unstuck, right? As they're moving around these 4 phases of learning. We know that learning first happens whenever students have hands-on experiences, right? That's the first phase of this learning journey is hands-on. Students have to have hands-on experiences. So what does that mean? When it comes to Patricia Benner novice to expert model, we don't want to separate, right? No separation between didactic plus clinical, right? We want this to be one unit, one experience, didactic and clinical. How do we do that? Well, we can have, like we just talked about with the flipped classroom, we can ask students to work in groups, group work, right? We can also engage students in role playing, right? So these are all ways, and let's do one more to make it look unified. So we talked about, let's see. Okay, so AI is trying to work with me. So with this Patricia Benner's model, we talked about novice to expert, and then the ways that we can engage students to avoid separation, right? We don't want separation between didactic and clinical. We can use the flipped classroom because that's going to allow students to start learning before they come in the classroom. We can engage in group work because that's going to allow them to think, pair, share, to learn from each other. We can do role playing and we can do unfolding case studies. Very good, right? So that's 4 different ways that we can engage students in the learning journey, on the learning journey, to think about what they're going to do differently, and most importantly, how we're going to bridge that theory practice gap, right? That's what we want to do. We want to bridge the theory with the practice to help the clinical judgment model, to help decrease adverse events, and to increase patient satisfaction, right? Because we know this is equivalent to dollars, right? This is too, but we know when it comes to patient satisfaction that there's patient surveys. We know that there's Press Ganey and other patient surveys, right, that want to quantify the quality of care and the experience with care. That's what they're all about. All right, so that was a lot, I know, but what we're talking about are the 5 learning theories, how to increase comprehension and decrease our muddy points. All right, so let's recap. That was a lot. We first started, remember, with flipped classroom. So why are we engaging students in the flipped classroom? Well, we want students to be active participants in their learning, right? We do not want to be that sage on the stage. We want to be that guide on the side. We started in looking at learner-centered courses. We started with talking about the fact that more than 50% of colleagues verbalize learning theory being a large gap area. Well, how do we close and bridge that theory practice gap? First, you want to consider what makes sense. So, practicality of it all. Number 1, talking about David Kolb's experiential learning theory. Number 2, talking about Patricia Benner's novice to expert model. We want to simply, as number 1 says, shift from a focus on covering decontextualized knowledge, which is just a fancy way of us bridging theory practice gap, to an emphasis on teaching for a sense of salience. Remember earlier I said you want to make sure that it makes sense to you as you're moving forward and closing your knowledge gaps on the C&E journey. Situated cognition. Oh, that's a fancy term. Well, again, it's making sense of the situation that we are given. And a good example is going to be unfolding case studies. We want to make sure that students have that solid foundational knowledge about concepts before we start to scaffold their learning or building on that prior knowledge, right? So we want to consider, what are those foundational elements? Okay, so what would they look like? Let's go back to our whiteboard. So what would those foundational elements look like that we're building on to help bridge that theory practice gap? Remember, that's what this is all about, bridging the theory practice gap. So you want to think about, what are those foundational elements that are helping our students? All right, so first we may want to think about skills, right? So what are those skills that we are engaging our students in from a formative assessment perspective, right? Because we're giving them feedback. Students are engaging in reflective practice, right? And we are giving our feedback timely as well. All right, what else is it that we want to focus on? When it comes to foundational, we not only do we want to give them feedback, but we want to engage in demonstration, right, of skills with our students, right? We want to teach them how to do it by showing them. We also want them to have a chance to receive that feedback. And last but not least is that summative evaluation. This allows our students to really validate their knowledge and for us to validate their knowledge too, right? And then the last component I want you to think about is going to be Bloom's taxonomy. We know that there are 3 learning domains, and we know that there are levels associated with each of the domain, right? So you want to identify what are the verbs, what are the action steps, and how do I build on prior knowledge, thinking about the foundational element, okay? All right, so just to recap, the 5 learning theories that you're looking at, we've talked about 2, write those down in your notes. We're looking at increasing comprehension and decreasing muddy points. With our students, we're working on building those foundational elements, which are tied to skills. Skills specifically allow us to evaluate students' knowledge right through formative feedback. And that feedback we want to be timely. We also want students to be able to engage in reflective practice through journaling. Next, we want to think about demonstration. Have we had a chance and taken the opportunity to really show students how to demonstrate these skills and giving them time to ask us questions? And then next is going to be our summative evaluation. How do we validate that learning has happened for our students as well as with our students? That's important for our students to know whether or not they're truly competent or are they still struggling in some areas. And then Bloom's taxonomy, we talked about that earlier. When it comes to the 6th edition, I want you to look at pages 188 through 190. Why do we use the 6th edition still? Because the CNE exam currently that's in place as of 2025 used the 6th edition whenever the exam writers mapped the questions to the blueprint that was revised in 2023. All right, so with Bloom's taxonomy, we know there are 3 learning domains and we know there are levels, right? So you want to look at what are these levels? What are the verbs? What are some of the teaching strategies and evaluation strategies at each level? And how am I helping my students progress and scaffold their learning over time? Right, over time. All right, so this is the last activity we want you to do, and that is to do your self-assessment. How are you going to do that? Self-assessment using the blueprint. Okay. And that is the NLN, CNE, CL, or novice blueprint. Okay. And they're all included in the handbook that's on the website, the candidate handbook. And it's free. So make sure you're using your free resources that are available from NLN. Okay. All right. So self-assessment, what you're going to do is using this blueprint to help guide you on your journey. And then the next step is we want you to join us on our C&E in 60 days journey. What's the benefit of C&E in 60 days? There's nothing else to buy. Okay, it's all included in your C&E bundle. That's the books, that's the study workbook. That is also your 7-week study plan. That is weekly sessions okay, where we are studying content from the CNE blueprint. And yes, it is for CNE, CNE clinical, and CNE novice colleagues. And it also includes our masterclass, and it is 12 contact hours offered when you attend the entire time, plus complete the evaluation. All right, so CNE in 60 days. If you're ready to go on the journey, it only takes 60 days, okay? No longer do you have to spend months and years figuring out how to achieve that passing score. But maybe you're not ready. Maybe you're not ready to join just quite yet on that 60-day journey. The other option you have is our boot camp. We love our monthly boot camp. We meet live 2 times a month, okay? So you can go to our homepage, and that's going to be drsellarseducate.com. And this is where you're going to find all the information that you need to achieve success on a CNE exam. All right. And to become a better nurse educator, because that's our goal. When we're on the journey, yes, we want you to achieve success. That's why we have 98 to 100% success for those colleagues that follow that 7-week study plan. And we also know that it helps you become a more confident nurse educator. All right, so last but not least, we didn't even get to our presentation slides, but that's okay. The most important part is that you're walking away with knowledgeable content and concepts that are going to help you achieve that passing score. So you have your homework. Pages 181, starting on page 181, gives you a great overview of the learner-centered model and what's important. And then you're going to continue to pages 188 through 190 that you see here, the domains of learning and learning experiences. Remembering to make sure you have a deep understanding of the verbs, the learning that happens at that level, the learning objectives, the evaluation strategies we're using, and most importantly, how do we help students at that level progress to the next level? How do we help them build their scaffolding over time so they can have the deep comprehension of concepts that we need them to in order for them to develop clinical judgment? All right, and then last but not least, we're going to wrap up. We didn't forget about the thought-provoking questions. So let's see how many of you chose the correct answer. If you chose B, organize a group discussion where students can share their thoughts about the simulation, you're absolutely correct. This is going to help align with David Kolb's reflective observation stage to help support students as they move forward on the learning journey. Our mission as a nurse educator is to support all of our students in achieving success in the classroom, in the skills and sim lab, as well as in the clinical setting. Our students that we're teaching today are not only going to be future nurses, which is great, but they're also going to be future nurse educators. Let's make sure that we are demonstrating evidence-based practices that are going to best support them on their learning journey as students, but also equip them with the skills, the professionalism that they need to be an excellent nurse. We hope this snapshot has been helpful, and we look forward to seeing you during our next snapshot, during our CNE in 60 days, or during our monthly boot camp. Have a great one, everybody. Take care.